Hello guys, I am Shirley Dash welcoming you to the show Pharmacy and Medical Crash Course Division in the Knowledge Club online. At previous episode, I ended after discussing about the class 3 type antiarrhythmic drugs, right? Today, I came with class 4 type antiarrhythmic drugs in cardiac pharmacology. Class 4 drugs are calcium channel blockers. They decrease the inward current carried by calcium, resulting in a decreased rate of phase 4 spontaneous depolarization. They also slow conduction in tissues that are dependent on calcium currents, such as the AV node. Although voltage sensitive calcium channels occur in many different tissues, the major effect of calcium channel blockers is on vascular smooth muscle and the heart. No more about antiarrhythmic agents in this episode. Stay tuned up to end because if you skip the lecture, you can miss our valuable points in between lecture. So stay tuned up to end. I am going to start today's episode. Let's start. Let's start to discuss about some particular drugs in class 4 type, that is the verapamil and diltiazem. Verapamil, in addition to its use as an antiarrhythmic agent, has been employed extensively in the management of variant angina like Prince metals and effort-induced angina pectoris. It selectively inhibits the voltage-gated calcium channel that is vital for action potential genesis in slow response myocytes, such as those found in the sinoatrial and AV nodes. The antiarrhythmic actions and uses of diltiazem are similar to those of verapamil. Diltiazem is effective in controlling the ventricular rate in patients with atrial flutter or atrial fibrillation. So, we will discuss of pharmacological effects combining for both drugs. Then the electrophysiological actions. At sinoatrial node, spontaneous phase 4 depolarization are characteristic of normal sinoatrial nodal cells. Release on progressive inhibition of an outward potassium current and an increase in a slow inward current that is carried by sodium and calcium ions. Verapamil and diltiazem decreases the rate of rise and slope of the slow diastolic depolarization, the maximal diastolic potential and the membrane potential at the peak of depolarization in the sinoatrial node. Hemodynamic effects. Usual 4 drugs of verapamil and diltiazem are not associated with marked alteration in atrial blood pressure, peripheral vascular resistance, heart rate, left ventricular and diastolic pressure or contractility. Next, pharmacokinetics. The pharmacokinetic characteristics of verapamil and diltiazem. The oral bioavailability 20 to 35%, onset of action 1 to 2 hours, peak response 1 to 2 hours, duration of action 8 to 10 hours, plasma half-life 2.8 to 7.4 hours, primary route of metabolism, hepatic active metabolite, primary route of excretion, renal 30%, therapeutic serum concentration 0.125 to 0.4 μg per ml. Clinical uses. Verapamil and diltiazem is useful for slowing the ventricular response to atrial tachyarrhythmias such as atrial flutter and fibrillation. These drugs is also effective in arrhythmias supported by enhanced automaticity such as ectopic atrial tachycardia and idiopathic left ventricular tachycardia. Adverse effects. Orally administered verapamil and diltiazem is well tolerated by most patients. Most complaints are of constipation and gastric discomfort. Other complaints include vertigo, headache, nervousness and pruritus. Contraindications. Verapamil and diltiazem must be used with extreme caution or not at all in patients who are receiving beta adrenoceptor blocking agents. Normally, the negative chronotropic effect of drugs will in part be overcome by an increase in reflex sympathetic tone. The latter is be prevented by simultaneous administration of a beta-adrenoceptor blocking agent, which accelerated the depressant effect of both drugs on heart rate, AV node conduction and myocardial contractility. The use of both drugs in children less than 1 year of age is controversial. So today we learned about class 4 antiarrhythmic drugs actions to treat arrhythmias in pharmacological relevance. I will come at next episode with the rest of the part of antiarrhythmic drugs, that is miscellaneous drugs which are used as antiarrhythmic. Revise the all episodes on heart thoroughly. I made it step by step accordingly. Here the all previous episodes list on heart anatomy and physiology chapter and cardiac pharmacology chapter. You will get all links at discussion part of this video, or you can visit our channel. Before ending today's episode, if you like this video, please like, share and comment freely. Don't forget to subscribe our channel. If you already subscribed, then thanks a lot. And after subscribing our channel, please click on the bell button for getting the regular updates of Knowledge Club Online. I am coming with another episodes very shortly for you. Till then, goodbye.